Let's do this. Yes. Hi guys, I am Dr. Noe from Beyond the Bump Chiropractic. Today we have a very special guest. We have our doula, Britni.
My business is Bump Baby and Beyond, doula services and more, but Bump Baby and Beyond.
Which is hilarious, right? Because
Yeah.
when I first started this practice, I remember we were looking all the doulas that were practicing in the Rockwall area, and your name came along, and so we decided to call you right away. And it was funny because we have
Yes.
similar names.
I know, she called and I was like, is this real? What is this?
Right, is this a joke? Yeah. So it turned out really well
Yes.
because we got to invite you to our open house, and
Yes.
we got to meet, and ever since then we've developed this great relationship.
Yes.
So we thought, why not bring her, since everything that we do has to do with the motherhood transition. We wanted to bring her in so she can talk about what it means to be a doula, and we're gonna have just a casual conversation, and
Yes.
we hope that you guys enjoy this time together. Can you introduce yourself and let us know a little bit about yourself? What do you do?
Well, I am a doula, and I also, aside from a doula, am a breastfeeding counselor and prenatal nutritionist. I love being a doula because I personally have 2 babies, and then I'm a surrogate, and so just birthing babies and helping mothers is just in my blood, and I've always watched kids and been like the mama to my siblings, so it just...
So you do love the motherhood transition?
Yes.
Awesome. What motivated you to become a doula in the first place?
After my first was born, he was born posterior, and so I
Can we tell everybody what posterior means?
Yes, so it's like sunny side up. It's not breech, but it's where the head, like normally you come out of the birth canal, like natural flow of the neck. Posterior, you're like curving their neck a different way to where it's like they can get stuck and they're born with a giant cone head.
Exactly.
Most of the time, not all the time.
So basically the baby's head should be facing the sacrum,
Yes.
which is the seat bone, right?
Yes.
Exactly. So it was facing the other way.
The other way, yes.
Okay.
And so I actually pushed for 4 hours with him.
Okay.
And I knew what a doula was, but I didn't research into it. And then after he was born, I was like, okay, what can make this change? Like, what can I do differently to birth? Because I got pregnant 3 months later.
Right.
What can I do to birth this one easier? And I kind of got into it. My midwife kind of told me about what a doula was and things like that. So I started researching, and I just fell in love with it. And I breastfed my first for a year. I was like, well, let's just do it all.
Exactly. Okay. So you became more educated in the field and decided to become a doula. That's wonderful. To help mamas like you be empowered during birth, right?
Yes.
Do you prepare the moms for birth, or
Oh,
are you
yes.
only assisting during birth?
Yes, so we have 3 different meetings that we do before the birth. We'll have the interview over the phone, or if you're local, like we'll meet at a coffee shop or something. And then if you decide to go further, we'll have a second meeting where we go over the contract and what all you want, what all the services you want that I offer. We'll put together like a plan, and then the third one will be closer to like 30 weeks, and then we'll do where we go over how you want your birth to go, how, like, if you want hands off, hands on, if you want your partner to be assist, or if you want them to just stand by your side, and I do all of the comfort measures.
So before we go into that, what does a doula do? So we know doulas are there to, guide mothers through birth, but what exactly a doula is, and what benefits a woman to hire one?
So a doula is a person that is like the mother's maid. So I am there to serve the mom. I am there to try to make her labor go as smoothly as possible. Even if she doesn't want hands-on, like I can go grab food for her while she's in labor if I need to run to the store and grab.
So in the back end, you can assist her as
Yes.
well.
So why hire one? I had this question when I had my first, and in between my first and my second, they help with being your voice. Like, I'm not like I don't like speaking to people, like when I'm in pain, like birthing, like I don't like telling the nurses, like I don't
Me neither.
Yeah. I don't like being the mean one, and it's not that a doula's mean, but you can be like, hey, like if you were my doula, be like, hey, like, can you tell this nurse, like, I just don't want her to talk about an epidural anymore, like, just, I don't want that word, like, can you tell her that to stop mentioning it? Or can you be like, hey, like, can you give me some more advice on what the nurse and the doctor meant by this? Like, I know different, like, most medical terms as far as birthing goes, so I can, if you have a question, you're like,
so you can be that liaison that they need
yes.
to communicate back and forth with the doctors, the midwives, and
yeah,
so
like
forth.
if you have some family in the room that is just irritating you or something, or like noise, and you just need your quiet, no noise, I can be like, hey, I need all of y'all to step out of the room. Like, I'm the person that is the mean one in that situation.
Exactly. I love that because that brings the mom an extra confidence, a boost of confidence that we need when we are going into labor, because we can feel a little bit vulnerable going through all these transitions. So having you there and support them, know exactly what their birth plan is.
Yes.
So they're not caught up with something. If there's something going on and we have to make a right away decision, you can be that person that is in the right mind to help her and guide her.
Yes,
to make that decision.
That's part of the third meeting, is we go over like what their birth preferences are. We kind of go over different like medical terms, just like whether they're having a home birth or hospital birth. More so that has to do with hospital birth than home birth, because if they're having a home birth, then they don't really need all those to know all those different terms and stuff that the doctors will use.
Mm-hmm.
And so
I love that. Perfect. What techniques do you use to help through labor and birth?
Through labor, you have like the peanut ball, or you have the medicine ball, the one that you sit on, and then the one that's like they have you put your legs in between that have the peanut looking one. There's different positions on those that you can do. There's like counter pressure, like with your like massaging their back. You have hot and cold, like with washcloths, or like I have these massage balls that you can just roll on their back. Heat packs, if they want, like if you have posterior baby, more than likely you have a lot of back labor. Right. And so the heat pads help.
And that's
on
when
that.
you told me.
Yeah. Yes, I did not know about you.
Then, right?
Yeah. He was born at 30, my first was born at 38 weeks, and my midwife told me I needed to go see a chiropractor, and I didn't get to it. And so that didn't happen, but he came, and he was born in the birth center. We didn't have to transition or anything to the hospital, thankfully.
Good.
And I have nothing wrong with, I delivered my second in a hospital. I just personally don't want to birth. Just because I don't want to birth in a hospital doesn't mean that I don't accept or support moms that want it, or like an epidural. Like if you want a C-section,
I feel like the birth world, in the birth, we should be able to decide what's best for us. Whether it's a hospital, it's home, it's a birthing center. I feel like we birth better where we feel safe.
Yes.
If we feel safe, then baby's gonna come, and that's why I always say treat it as a sacred moment, and look around and picture your birth and write it down. How does your perfect labor birth looks like? So you can actually envision that and make it happen.
Yes. And then that's where doula comes in too, because we help with the there's it's not, I don't want to say negative side, but we kind of help if something is not going the way as planned. Like when my mama had to transition to the hospital, I helped ease her confidence, or boost her confidence from switching to the hospital. I was like, just because you're going, you can still deny an epidural if you want one.
Exactly. So if your plan changes, hey, it doesn't matter. We can shift mindsets and move with the flow. So we can turn it into a positive thing, And obviously having the right team, birthing team there, it's gonna make a huge difference.
Super
so
important.
that's why it's so important. How do you stay current with your knowledge?
Actually, it's funny that you say that. I started looking into pelvic floor classes to take to be.
So a lot to come here at Beyond the Bump, because not just to say this, but about the techniques to couple with pain during labor and whatnot. We're gonna provide those classes here at Beyond the Bump Chiropractic, like a little intro, so mom and dad can be more confident at the time of laboring. If you don't decide to hire a doula, but you want to be part of those classes, it's something that we're going to be offering in the future. Are you okay with
Yes.
that? Okay, wonderful.
I would love that. Before, because I've had my kids, they're barely a year apart. Obviously, like it's like mamas don't want to talk about it, but I mean things change down there, and so I've started looking into classes for myself to help with my pelvic floor, and so I was like, I want to offer this to moms, like even if I don't become a pelvic floor therapist, like take classes on how to prep them before their birth, like exercises they can do with their pelvic floor and things like that.
Exactly, and that's huge because postpartum recovery
Yes.
matters, and we take it for granted most often. We call it the fourth trimester.
Yes.
For a big reason, and because we tend to want to go back, and that's like another big subject, postpartum.
That's my issue. That's my issue, yeah.
Yes. We want to rush back into what we were before, and we don't embrace the new us. And that's a huge problem that society is living nowadays, that we don't take it easy, we don't slow down, and we think that that's the way it's supposed to be. We're expected to be back in track right away, and that's not really the case. You go through birth, that's a marathon, right? It's a big deal, and we have to take it day by day. And so what's your favorite part of being a doula?
My favorite part about being a doula is helping mothers achieve the birth that they want, even if that has to be tweaked. I know that I love giving birth so much that I became a surrogate. Call me crazy, but I love just like seeing, like I even cry sometimes when mamas, like when their babies finally come out, like, and it's just like watching
it's
them,
such a magical moment.
it is, and knowing that like I helped them birth with confidence and ease, and whether because I've attended C-section births too, where the mom, like, because of everything going on.
This is great to know.
Yeah.
This is very important, okay? Because even if you have a planned C-section or an emergency C-section, if this happens, what do you have to say about that?
So I had a mom, it was a planned C-section, but it happened a little earlier than she anticipated. And so her husband could not come due to, at the time, hospitals weren't allowing kids to come, things like that. So I stood in the room and FaceTimed her husband for her because she couldn't. And I was just there, and she was just talking with me, and we were just as if I was her partner, in that, because her husband couldn't be there. And then I stayed with her until she was up walking, and then after that would be when you move to like postpartum services. So like the C-section up until like the day after would be like doula, but then if you want me to stay longer like at the hospital with you, that would then go into postpartum, because it's not labor help anymore.
Exactly. Okay, I love that. All right. How would you describe yourself as a doula, right? Because there's so many doulas, just like there's so many chiropractors out there.
Yes.
But there's one thing that defines us as women that makes a difference, right? So how would you describe yourself as a doula, and what makes you stand out?
I would describe myself as a doula that is open to any type of birth, any type of like technique you want to do, even unassisted. Obviously, like I'm not a midwife, I'm not a doctor, so I can't help you physically deliver, but even if you want to go the unassisted way, like I can be there as your doula. And most doulas, like I don't want to say most, but they don't want to do the unassisted side or the home birth side because of like liabilities and risks and things like that. And that's what I think sets me aside from other ones, is because I had a birth center birth, and my midwife, she had home births with all of her babies. And so that kind of opened my eyes, like, it's not this like negative thing that everybody thinks it is. It can be natural and beautiful, and but so can a hospital, and so can an epidural or a C-section. Like we went back
whatever that experience you want to experience.
I want to help you experience it. Yes,
exactly. You have other extra skills outside of labor and support. What are those?
So my business name is Bump Baby and Beyond, but I have doula services and more because I also offer prenatal nutrition, breastfeeding. I'm a breastfeeding counselor, but I am moving to advanced lactation within the year. I'm taking that course now.
Oh, wonderful.
And then postpartum doula, and I'm also a childbirth educator. So all of those that are birth, and then I'm looking, not yet, but I think I want to become a midwife, but I need to research that more before I do.
She does have 2 babies.
Yes.
One in the way, and then you're planning, or you will like more babies too.
Yes.
So I love that because, an empowering mama that, is raising a family while she's also growing a business. That's huge, right? So how does that feel? Like,
it's surreal that it's been like, looking back on like when I started it, I was like, it doesn't feel like that long ago, but then it was at the same time. And just seeing, like, meeting you, like, was like the first huge step in my business, and I'm like, wow, like, it's really happening.
I know, right?
And then yesterday I had a doctor's appointment, and I had a different OB than my normal OB, and she was like, so you're a doula? Like, we kind of mentioned it, and she was like, oh, where are you, like, who are you a part of? And I was like, I have my own business. And just saying that, I was like, I do have my own business.
Right. And it feels good, and you should be very happy with it, because it's hard work to raise a family while you're building a business. So I want to congratulate you for that, because that's pretty impressive, and also having future aspirations.
Yes.
That you're seeking for more. Okay, what's the next step?
Yes.
Because when you're a mother, there's not a lot of extra time. Right?
No.
So
there's not.
Exactly. There's not.
Whether you work or you're stay-at-home mom, they're both like, you have no time.
Exactly. And there's also like this mom guilt that follow us everywhere, right?
Yes.
And so whether you are, like, if you're at work, you feel bad that they're in childcare or at school, right? If you're at home, you feel like you're missing out and you're not giving the world your knowledge, your skills, right?
Or there's like, I know I have my business, but right now it's more like I'm a stay-at-home mom than, because obviously, like, I'll get a call like, hey, I'm in labor, and then I go. And so it's more of like, am I not teaching my kids enough at home because they're not in a daycare? And so, like, it's all, there's negatives, and like, to whether you work or stay home, and it's just, and
I feel we can talk about mom guilt for hours.
Yes, that's a whole different topic.
We feel it everywhere, like even nutrition. How are we gonna do wellness with them? Or
it's like, oh, I'm tired. We just throw some chicken nuggets in instead.
Exactly. Exactly.
Chicken nuggets for the 5th day. It's okay.
Yeah. So I always say remove mom guilt,
yes,
because there's no need or no room for that negativity or just feeling sad. Instead of that, let's change that mindset into a more positive, like, hey, look at all the things that I accomplished today, whether it's at home, staying at home mom, or whether it's going to work and then having to be a mom in the afternoon. So I think every single aspect of it is beautiful, and it's just surrounding yourself with women that are doing it, that are gonna bring that motivation. Just like we said, like, once we met, we keep motivating each other to do better, and that's what it's all about. All right, so last but not least, we're going to talk a little bit about breastfeeding. These are the most common questions that mamas have about breastfeeding, right? Because breastfeeding, sometimes for first-time mothers, we go into postpartum thinking that breastfeeding is going to be something very straightforward, that it's going to just happen magically, but there's so much behind it, right, that we don't take into consideration. So obviously educating yourself before, while you're pregnant, and then having that support after delivery is huge. So the first question, are there any techniques or tips to help ease pain during breastfeeding? Because pain is very common at the beginning.
So there's pain like after you have your baby, like whether you want to dry your milk up, like you're still gonna get engorged after you have the baby and you have to dry that up. So there's that pain that you have to go through, which there's warm compress, like where you get like a heat pad or you get a cooling pad. In the shower, don't let the water run like directly on your boob, and you should let the steam warm it up, and then you can try to like hand express some of the milk out. Like if you're super engorged, like that kind of pain, like the first, I would say like 2 weeks that after you have your baby.
Right.
And then especially if you're trying to dry your milk up, you don't want to pump, so the shower is the best, just to get a little bit out at a time until you dry up. And then as like
okay, I've always had this question,
Yes.
so sorry I'm cutting you off. But you know, you heard a lot practitioners, specialists saying, hey, you need to pump while you're pregnant, to increase milk supply and be ready for when the baby comes and that first milk, the colostrum and whatnot. Is that something you recommend, or should we not stress about pumping before having the baby?
I would not stress about it. They actually, like, you have to talk to your midwife or your OB about it, because I personally, there's a lot of, like, it's like a seesaw almost, whether like people are on board with it or not on board with it, whether like I breastfed my first throughout my entire pregnancy, but with like there's like controversy behind, like it can make you like have your baby early or miscarry if you're early on. I personally still breastfed through, but me and my provider like said it was okay. And some, like if you're a higher risk pregnancy, then you may not want to do that. As far as pumping, they just say like it's called the Haka. I wouldn't get an actual pump. Like there's no reason for that. I would get, if you have leakage, which most don't even have like leakage until, I mean,
that's normal, not to have any leakage.
Yes, that is normal.
Because actually most people don't know that milk doesn't come along.
Yes, until after. It's
after.
like 3 to 5 days almost.
Exactly.
Fully maturing is like almost 2 weeks when it's like the milk color.
Exactly. So no stressing before.
Yeah, don't stress before.
Exactly. All right. So that's a great tip right there. And then we're talking about the pain. Is there anything else that you would like to add?
You can like massage, like they have like the massage rollers that have little like prickles on them. You can like kind of massage your boobs in a downward, like towards your nipple.
This is for engorgement as well?
Well, yeah, engorgement or just pain. Like if it's like you feel a little bitty lump, or just like, as far as nipple pain goes, there's like creams you can put on, or just like coconut oil if like your nipple's getting dry, or cracked or something like that.
Yeah.
And then if that's the case, if it's like, if your nipple starts like bleeding from your baby, like after your baby's on the breast, maybe that's like a latchment issue.
Exactly. That might be a sign that your baby's not latching correctly, and so that needs to be addressed. So that's why you would have a professional come in and see how the baby's latching into mom's nipple. And there's a lot of ways to help that be improved, because you should not feel any pain.
Yeah,
right?
The only pain should really be the engorgement, and the like sometimes they may dry out, and that's just when you put a little lotion or cream on it to help.
Yeah. So if you're a breastfeeding mom and you are having pain and it's not engorgement related, make sure you call a professional like Britni, so we can help you navigate that and see why is baby not latching well. Sometimes they're not able to open their mouth properly. They have misalignment
or tongue ties or
tongue
things
ties.
like that.
Yes, so many things that can be revised before it becomes a problem. how do I know if my baby is getting a sufficient amount of milk? And this is like a very common question that we worry so much as moms.
Yes. So if your baby is gaining weight, whether it's like, it doesn't have to be a full pound. It depends on the age of your baby and what they should be gaining. As long as they're not dropping weight and they're at least like maintaining or gaining a couple pounds before their next appointment, or depending on age that they are, then there's no concern behind that. Like from personal experience, my first, he nursed for 10 minutes every hour, just 10 minutes. My second would nurse for 30 minutes every 3 hours. But and that was like, they were way polar opposites, but I knew they were getting enough because they would fall off or they would just not be fussy.
Exactly.
Yeah.
So there's no right or wrong. It's again bringing that confidence into mama that, hey, baby's getting the right amount of milk, and every baby is different. Every baby's needs are different, just like ours.
Yes.
So just
and also like in the hospital, like a lot of mamas will have issues because they want them to have a certain amount of milk, like breast milk, before you leave, and then that's where like you have to readjust because your supply is not going to be making 2 milliliters by 3 days. Like that's because your milk hasn't even come in yet. So then like that happened with my first. I had to pump to start boosting my supply, or my second, sorry. I had to pump to start boosting up my supply because they wouldn't release him until he had started drinking enough milk, and so we had to supplement and things like that. So then that's also where breastfeeding counselor or person comes in hand, is helping you adjust your milk supply back to what baby actually needs.
Exactly, which is huge. Yes, absolutely. And what is the best way to treat mastitis? So inflammation, when that happens, when it gets to the point that it's, it's
actually
worse.
Like infected and at its worst. There are once you get like, when you see the red on your boobs and it's hot, like, and you have a fever in your boobs, and that's typically when you actually do need to go to the doctor, and they usually prescribe a pill. If you don't want to take that pill, there's like holistic things you can do, but you need to be careful because it can dry up the mastitis can dry up your milk because you're so engorged for so long. It's just getting clogged and clogged and clogged, and your baby's not getting it out properly. You can do like the shower thing that I said, and then roll kind of the same thing with if you have pain. Yeah, engorgement. It will hurt a lot. Not gonna lie to mamas, it will hurt when you massage it, and sometimes like it's like milk clots that will come out, and that's when you know you're getting it out.
So what are the natural remedies that you would suggest?
Like you can do like essential oils, like rub them on there for like inflammation and things like that. Not on your like nipple, but around your boobs, like your chest area. And
would you recommend them to change their nutrition or anything like that?
So that's what I was about to say. Like water is your best friend. So coffee actually
bring your body into a more alkaline state.
Yes. So
rather than acidic.
Like coffee dehydrates you, and I'm not one to say like completely change your diet, even though like I'm a prenatal nutritionist. I say like you want to enjoy the change. So like don't cut something out. Don't say no, I can't have that. You just want to maybe have like half a cup. Say you have 2 cups, maybe have 1 cup, and then if you have 1 cup, have half a cup a day. Things like
that will
and water and coconut coconut milk, or coconut water.
Yeah,
are your best friend
to get that hydration.
Hydration, yes. And dairy is also one that is like, it's like a controversial one, like whether you cut it out or don't cut it out, because it can also like upset baby. So
So I would say like those foods that tend to be inflammatory for most people. If you're going through this issue, like a mastitis issue, make sure you cut off these things, so you can get rid of that inflammation faster.
Yeah, a lot of people don't know is broccoli is and like cauliflower, things like that, make your baby really gassy.
Oh, that's
So
super
yes.
uncomfortable for baby.
Yes.
Even though obviously we're trying to get the right nutrients into our body, like with green leafy vegetables.
Yeah.
But if you notice,
sometimes it's like
yeah,
not good.
so you gotta do what you gotta do, and obviously like eat the right foods, but just know that things can happen. All right. So is there a specific diet I should be following while breastfeeding? That's a great time to ask that question because of this what we're talking about.
Yes. So I've kind of covered a little bit of that already. Like, kind of like read your baby. So like if your babies don't. They can, but they don't sleep through the night most of the time. But if they're up an unusual amount, like my boys, like one was up every 3 hours, one was up every hour, and that was my second one. I was like, okay, and that's after I had started taking courses and becoming certified, so I kind of knew a little bit more. And I was like, okay, so I need to cut out some dairy because he was having like skin issues. So you kind of read your baby on your nutrition as far as breastfeeding goes. I've had mamas that their babies are super gassy and they're like, why are all of a sudden they gassy? Right. And so you cut out some of the greens.
Maybe have like a little journal that
yes.
you can write down the foods that you're having and see if it has any reaction or if it has any correlation to your baby's reaction or behavior. We all know that babies are going to wake up when they probably, if you're a breastfeeding mom, if baby needs more milk and needs mama to make more milk for them, right?
Yes.
We're going to have to be breastfeeding more often for that to be the case. So yeah, case by case, right?
Yeah.
Every baby is different, but
and
just knowing.
With the journal, don't cut out one thing at a time, not everything, because then you're like, well, what can I eat now? And then you get depressed, like not depressed, but then you get
you kind of
down.
get
Yeah, I don't want to use that, but you get like down on yourself or depressed. And then so like cut out one thing at a time. And dairy takes a month to get out of your system. So that give it 2 months off of dairy, things like that. Like it's not going to be. And like certain foods take 1 week, certain foods take a month. So it's you need to, when that journal head's like, right, when you stopped, and then when your baby started showing adjustments or whatever.
I love that. Yes, that's awesome. That's a great tip right there. All right, so we did have a few extra questions as we're wrapping it up from our mamas, social media mamas, and they asked, what's the longest birth you've been part of?
So that would be my 3-day birth with the mama. I was with her. So this is another thing where a doula can come in hand, because your OB or midwife is going to come when your OB, you go like either when your water breaks, or your water doesn't always break until the baby's coming out. So it's like based off contractions. But I went to her house on the first day when she was laboring at home, because she was a birth center. So you don't go until it's almost time. And you're only there for like 4 to 5 hours, and then you go home.
Right.
And so I was with her at her house for the first day. I went home because the things had stalled a little bit, and then I came back the next day. Then we finally went to the birth center. We were there for a day, half a day. Went at like 4 a.m. or 2 a.m. to the hospital, and finally the baby was born the next day. So I followed her through the whole thing, and that's where a doula is nice, because she was getting so down on herself, and it wasn't her fault at all. Things happen, things like the universe, things don't align sometimes.
Exactly. There's room for uncertainty, right? And they don't know. Things are gonna unfold how they need to be, unfolding.
And at the end, she had a healthy baby, and she was healthy, and so she changed the way she birthed a little bit, but she didn't regret it. Like, she ended up getting an epidural, and I'm like, look, and she was like kind of upset about it. I was like, look, you've been doing this for almost 4 days now.
Right, exactly.
Don't be upset at yourself for finally getting.
Don't be discouraged about the things that we cannot.
Yeah, because when you transfer, your dilation can go back. It messes up the whole birth flow. When you drive or go from one building to another building, and so it was just everything can factor into
Exactly.
your birth.
Exactly. What is the intent? And this was a huge question because we always wonder about a postpartum doula. So what does a postpartum doula do?
So a postpartum would be like after baby's born, which I could have an initial consultation like before baby's born, because if you pre-set up like times, then like that you would want me, then I would know as soon as baby's born, like you tell me, and then I'm showing up whenever we agreed. But a postpartum, we either assist with the mother as far as like we're not a nanny and we're not like maid, but we do kind of help with those things a little bit.
Right.
Like we're not full time, but like I can go for either 2 hours or 4 hours to your house. I can go get you groceries. I can cook some meals for you and put them in the freezer. Or if you just want me to come one night so you can shower and I watch the baby and I cook dinner, something like that. I personally like to focus more on the mom rather than the household, but I can help with the transition for siblings to the new baby, or like as far as if you need help bottle feed, like how do I bottle feed? How do I breastfeed once I get home? Like safe sleep.
Exactly. I guess you will ask the mother how you can support her and make her feel supported, and that looks so different for everybody.
Yes,
right?
It does.
Like for example, I am so crazy when it comes to cleaning and having a tidy home, and that's impossible when you have extra kids at the house and you have to get out of the house at a specific time. That's impossible, right? But if it stresses me out, I can let the doula know that these are my standards and like how can we meet those standards. So that's not in the back of my head, and I can focus on being
on the new baby,
on the new baby. That's what matters.
Yeah,
so
whether it's like a load of laundry.
That would be an example, right? But again, it can be different for everybody, right? What are your
household,
expectations? How do you feel loved? How do you feel taken care of? And all the things that
what's your love language type thing?
Love language is different for everybody, right? So it goes into detail. So that's why like having that rapport with your doula and like knowing her and she knowing your expectations in detail will mark how the outcome of becoming a new mother.
And that also helps with the postpartum depression, and a lot of like mamas, like it would help kind of not get that way,
And I love that you're saying that, because how many times we don't know that, right? And we want to do
you
it all.
think you're fine,
Yes, we always say I'm okay, right? And this is what society expects of me.
Yes,
being Wonder Woman, do everything around the house. For mamas that have kids already and had a newborn,
multitask, all the love for the kids.
Exactly. And so hey, it's okay to need help. It's okay to open to that kind of help, because you're gonna heal better. You're gonna be a better mother for the newborn, for your other children if you have more of them. You're gonna be a better wife. You're gonna be more present, and that's the idea of all these things, right? If we have that support, then we're present and we can be the best version of ourselves, right?
Yes, and that's why I like to focus on the mama, to make sure that she's recovering in the right way as well. Because I mean, yes, baby's out and everybody wants to see the baby, but like who's taking care of the mama? And that's where I come in.
Exactly, and I love that. And you can tell that you love what you do. So obviously, we want to share with everybody. Where can they find you?
So I'm on Instagram and Facebook, Bump Baby and Beyond. And then if you type in on, because Google, I know you had the whole Google thing when you first opened.
Yes,
I know.
I'm still figuring it out.
When you Google, for some reason, it makes you put Bump Baby and Beyond Rockwall. Like it doesn't. I'm trying to get that fixed where you don't have to type in Rockwall, but.
Okay.
That is how you can Google, and that'll take you to my website, my Facebook, my Instagram, everything.
Excellent. Do you have a phone number that they can reach you at right away?
Yes, it's 214-558-1118.
Say that again.
214-558-1118.
Wonderful. Thank you so much for your time.
Yes, I had so much fun.
Me too. It was very special. Thank you so much. Salud!